In today's timeout, we have the very talented, versatile, all-rounder Mike Reinold. It's great to see you, Mike. How are you?
I'm awesome. Thank you so much for having me. I've been looking forward to this and getting together to chat. I know we have a lot of similarities and a lot of probably experiences that are probably pretty similar, even though we're on different parts of the world. So it's always fun to chat and to talk about that with other people. So thanks so much for having me.
I mean, you've been with the Boston, what Sox is that? Red Sox, and then Chicago. Sorry for my lack of knowledge in baseball.
Yeah.
Consulted the Chicago White Sox now. You're a doctorate in therapy, athletic trainer, strength and conditioning. Have you left anything?
I don't know. I just, to me, it's all about just, working with the athletes. So for me, yeah, I mean, I have a lot of different backgrounds in physical therapy and athletic training and strength and conditioning. But, I kind of see like, when we talk about working with athletes, having all spectrums of injury prevention to acute care to what to do with an injury and then getting them to optimal performance. I think that's what it's all about. So that's kind of why I have all that weird background.
And on top of that, you have your Champion Physical Therapy Center.
Yeah, so we have a physical therapy clinic and a big sports performance gym in the United States. It's just it's outside Boston, Massachusetts. So, it's a great place to work with people that want to get the most out of their body. So, yeah.
And I see all your interns. I mean, it seems to be a bright bunch of people there. I mean, how do you manage that?
You know what? I've always worked and I've always been fortunate to be in a setting that focuses on education and growth and professional development. So I've kind of learned that from the beginning, early on in my career, that was a value that we put a lot of emphasis on. So when we tried to create our own kind of new facility, we wanted to have that here. So if you look at our group of people, we have a bunch of physios and strength coaches that all, I think, value that all have growth mindsets, that are all always trying to get better at their craft and learning as much as they can. So it's an important part for us to make sure we have that learning environment because it's so much more engaging for all of us, right? It's selfishly for me too. I want to keep learning. So it's been real fun and rewarding to kind of build that.
And you can play a guitar. I mean, you have so many other really multi-talented.
I work hard.
And you run a business well. Fantastic. So before we fasten the seat belts and get a little serious about our subject things, I'm going to put you on the spot. LeBron or Michael Jordan as the GOAT? Who's the GOAT?
Yeah. LeBron or Jordan, man, I don't know. See, I'm older. I mean, we're probably similar in age, right? I think we go back to Jordan, and in my reason why is Jordan changed the game. He changed the game back then, and I don't, LeBron's amazing, but I don't know if he's changing the game as much as Jordan did back in his era. So that's why I give a little bit more credit to Jordan, but they're both amazing.
Okay, I'm a basketball nut, so I'm going to ask you the all-time at the end of the program. Okay, now, shall we get into the question segments? And
let's do it.
I mean, when we have a show like this, all my interns, my trainers, all of them get excited. So there are numerous questions. Remember, I'm the messenger.
Great.
You can't shoot the messenger, but the be shot in a very succinct fashion here.
Oh, good. I like that. That's great.
Okay, let's get going. In season, I mean, whether it's basketball, MLB, or even cricket, you understand a little bit of cricket for sure. You prefer unilateral training or bilateral training, and you have to give me the reasoning.
Yeah, I like that. I do both, right? I actually don't believe there's one way to do it. So we do a ton of unilateral training, obviously, because it's important. Much of what we do on the field or the court or whatever it may be is unilateral based. So we definitely want to work that in terms of like a functional movement a little bit. But there's also something to be said about just some bilateral movement patterns to develop some strength and power as well. So for me, I think to most questions, if you ask me this or that, I'm probably going to say both to some extent.
You've seen numerous shoulders, and we call you the shoulder doc. Literally, the amount of pitching injuries you must have seen in Major League Baseball is just mind-blowing.
It's crazy.
In the last 15 years, there have been so many we can say that things have evolved. What is your take when it comes to a shoulder impingement? Okay, let's say that you finish your basic rehab and stuff like that. Will you still stick with that body blade, Swiss ball, and wall slides and wall engines and all the other stuff, or you will go hard on the isolated YTWs and then go integrated?
I love it. So you gave me another this or that question, so I'm going to answer both again, right? But yeah, no. So here's my philosophy on that a little bit with the shoulder. I think you need to be strong and stable, right? So you have to have strength and dynamic stability. If you don't have both, it tends to not work as well, right? And they both go together so much that I think it's super important that you have to do some of the basic exercises like shoulder external rotation, Ys and Ts, but then you also have to focus on some endurance and posture and dynamic stability. When you put that all together and you start working on both the control and the strength of it, it's really fun to see some of the progress you'll make with your athletes.
So you still work on postural stuff.
Absolutely, because it's all about establishing the base, right? And when we talk about the shoulder, what's the shoulder? It's the glenohumeral joint, right? So the glenoid is part of the scapula. The scapula is part of the scapula-thoracic joint. The thorax, your rib cage, connected to your spine, right? So they're all kind of related, and where your thorax sits and how it functions and moves will dictate where your shoulder gets to sit and move. So I think it's really short-sighted to not kind of look at all of that together.
Tommy John injury. I mean, we guys have not seen much of it, and you're
Good.
sort of an exponent in this. You've seen so many of it. Please throw some light.
I know there's so many to us, but so what's happening with us in America and really around the world, but in baseball, is that there's such a large focus on velocity and how fast that people can throw the ball, that the emphasis is on that almost more than anything else. So they're really just overdosing, right? We're throwing at max intent at all times and just trying to work on velocity. It's a physics equation, right? The harder you throw and the more often you do it, the more stress you put. And what we've learned with the Tommy John ligament, the UCL, your ulnar collateral ligament, what we learned is that when we throw a ball and we pitch and you do it at max effort, we're putting it near its end physical load capability. So meaning like every time we throw, it's very much near the end of the max amount of stress it can handle. So there's no doubt that if we continue to keep pushing velocity and throwing as hard as we can, that we're putting more stress, and then more stress does unfortunately relate to injuries.
How much do you really rely on isokinetic equipment?
So personally, I don't. That's a good question. Now, I believe in isokinetics and I love isokinetics. The problem with isokinetics, at least with us here, is they're super expensive and they're gigantic. So not everybody has the capabilities of putting them in their facility, both financially or even physically. So we personally don't have one. I used to use one all the time, and I've used one in various settings. And I think I'm doing a very good job without it. So I think it's very clear that you don't need it. But yeah, the more objective strength measurements you can take, the better. So if you have access to it, it's amazing, but there's other things we can do.
Superb. The core word. I mean, do you think in the early 2000s, the Australian physios, do you think they overemphasized the whole thing and too many Mickey Mouse exercises came into the strength and conditioning world?
Could be, yeah. No, we see that all the time. It's just, people get excited about things, right? And then you tend to overemphasize things. And then when you get more mature and a little bit more experience in our professions, you realize that it's almost like coming back to center. Very easy philosophy for us here, but it's almost always the case. But simple is better than complex, right? So the more simple we can be, master the basics, and man, that's going to be much more beneficial.
The upper traps and the subscapularis, even though they are overworking, you still feel that when you're doing a shoulder rehab, there is a place for these two muscles. And will you go hard on it, or will you go, okay, let me use it as a supplementary exercise?
That's a good question. I think you're right. Upper trap, subscap oftentimes are overactive. I think that's a great way to do it. I would say it depends on the person, and you want to take a step back and make sure you're doing a good assessment of their balance and their imbalances, right? So for me, an overactive upper trap or even a subscap, for example, may not be terrible if you have a lot of good strength in maybe your lower trap and your serratus or your posterior rotator rotator cuff. So yes and no, but I would say I am going to probably emphasize more the balance. If you look at like our programs for our baseball players, like our overhead athletes and cricket, all those things I think would be very similar, is there's a lot more balance posterior and lower trap than it is upper trap serratus. So we don't neglect them, but we definitely overemphasize the other imbalances.
I mean, chondromalacia patella, especially, I mean, you've seen all the physios who work with us, they immediately go on the clams and the monster walks and sideband walks and they go gung over it. I mean, what is your go-to exercise when it comes to patellofemoral syndrome, runner's knee, chondromalacia?
Yeah, I think you just indirectly kind of hit it perfectly right there. Oftentimes, what we found with knee pain, especially somebody with the patellofemoral pain, so a generic type of pain that's not a specific ligament or meniscal injury or something like that, but patellofemoral pain, we often find that it's from overloading from stressing that's coming from the hip or the foot. Right, the foot and ankle. So I think you said it really well. You know, you jump to things like the band walks, the clams, because oftentimes people have poor control outside of the sagittal plane. So we see that their hip adducts internally rotates. It puts a lot of torque on the knee, a little valgus position. Maybe you'll get increased stress. And we know, like, there's, you know, if you squat with more toes, knees in or knees out, it changes the contact pressure of the patellofemoral joint. We know that biomechanically. So if you load in those patterns, then over time you're at risk of just maybe overloading the structures a little bit more. It's not inherently bad. You just maybe a little bit easier to overload the tissue. So yeah, we're going to focus on the hip. We're going to focus on foot and ankle control to try to keep that knee in that sagittal plane and stable as well as we can.
Very well said. When do you resort to cortisone for the shoulder? I mean, you've done all your rehab work. Let's say that you have a couple of pitchers who are dodging and they're not able to do the exercises properly, and you've done your best from your part. Will you be trigger happy to go with the cortisone?
I mean, so it depends on the person and the timing and what's going on. So a younger person that we're trying to rush back out on the field, probably not, right? But maybe it's a veteran, maybe he's a professional athlete, so there's a very important game coming up that may change our mind a little bit. But here's how I think that we do that with our physicians here in the United States. So our physicians do the injections here in America, not us on our end at the physios. But we would often do that with the physicians when you get to a point where you're stuck. And this happens sometimes. Sometimes there's enough inflammation and pain in any joint, really, shoulder or anywhere else, that it inhibits the ability for the muscle to contract. And then it's really challenging for us to make progress. So oftentimes we'll do that as almost like a kickstart to our rehab process so that we can get more out of it faster. So it's a useful tool, but we wait for the appropriate time and person to do it on, I would say.
Pilates, flywheel, blood flow restriction, vibro gym, all these toys and their modalities. Your take, Mike.
There's a ton of toys, right? So over all of our careers, and I'm sure you've seen this too, right? There's so many new gadgets that come out kind of every year. Some stick, most don't, right? So, and I'm humble enough that I try a lot of them, right? And I want my patients to try them because I want to get their feedback too. And it's usually pretty clear with the things that stick, like you said, like the things that I think have a sound, like theoretical or science-based rationale behind using it, as well as the patient perceiving it as being helpful for them. So you mentioned a bunch of things. Like, excuse me, for Pilates, right? I'm very pro mobility and core control. I think that's great. I think Pilates is here to stay. There's a bunch of like other things. You mentioned blood flow restriction training. I'm a big believer and user of BFR. We released a new course teaching everybody how we use this recently. I think scientifically. I just released the one we have. We just released one like a couple of months ago. We just released a new one because we wanted to wait. We wanted to use BFR ourselves and really feel like we mastered how we use it before we taught others, right? So we've alluded to it in the past, but I think in terms of like saying, okay, here's how we use blood flow restriction, we wanted to wait till we got it right. But I think there's a ton of science showing that it's effective, right? And that's important to me. I think like everything else, sometimes we do it too much much initially, and then we have to figure out the right person to do it on. But it's really neat to be able to get some strength gains in somebody that isn't able to fully load. Right. So maybe because of pain or an injury or surgery, and they're not able to do an exercise with a lot of load. By using blood flow restriction, what happens is we can actually stimulate the body to think that it was working out with more load, and it gets all the same benefits. So some things like that stick, some things don't, right? And I think it, it comes down to your experience. And, even some gadgets work better in some populations than others. So I'm never one to just throw one out and say that it's ineffective on everybody.
Well articulated, very well articulated.
I like this rapid fire, by the way. This is kind of fun.
I know that you are hard pressed for time and a busy man, so rapid fire with you. When do you use body weight exercises like Sorensen holds, planks, side planks, split squat holds? How much is it important, and where do you use it, and what is the volume you'll be looking at in a weekly schedule?
Yeah, isometrics have become a popular topic online mostly. And I think what happened was it evolved a little bit. I think we showed that in the literature that isometrics were helpful with some pathology by reducing pain, which is great. Like, so if you have patellar tendinopathy, Achilles tendinopathy, some isometric holds could help with pain neuromodulation, and then we could have maybe a better training effect afterwards. For me, though, I think it comes down to load, right? So I think this is another kind of question. We look at this in our research activities. What's best for a tendinopathy, for example? Is it eccentrics or concentrics? Is it eccentrics or isometrics? What is it? And I think the answer is almost always going to be that a blend is better. Right. So what we do is we use like a sequence of activities. We do isometrics. We progress them to heavy, slow load concentrics, and then eventually eccentrics as somebody progresses through that. So I would never say like, well, no, isometrics are the way to go, and that's the only thing we do. But I think it's a very important component that we can use with a lot of our exercises, either initially because we're trying to like make sure we don't have like muscle atrophy, but more so with the tendinopathies to help neuromodulate pain.
On a regular day, will you use it as a finisher? Say, let's say a Sorensen hold for 2 minutes, or a wall sit for say 30 seconds, or a split squat hold for 60 seconds. Will you use it?
Yeah, good question. It depends on the pathology. So and on the muscle.
There's no
groups.
pathology.
So one
just as a finisher.
So just as training, I may, but it's going to depend on a lot of things. So that type of finisher at the end for me is very endurance based. So if you're trying to get somebody that is trying to build some endurance, then absolutely we're going to work in endurance based capacity at the end of their session. But if they need to get to a game later that day or a practice, then we may not want to burn them out at the end. But more importantly, I think it depends on the body part in the muscle group. So I would not do that on postural muscles, right? I would do that on our active muscles. So let's say the rotator cuff or our low back or our core. I don't like working them to failure and endurance-based holds for those, because those are my stabilizers that need to be active when I go perform my activity later. So I may do that for the quadriceps, but probably not for the core or the shoulder, for example. Okay. And that opinion may differ, and I understand that. But for me, I don't want to fatigue out my postural muscles. Here's a great example. Take a body blade, right? You mentioned body blade earlier. Do a body blade until you fail, right? So keep doing it until you're doing it and you're feeling it burn. You're feeling that kind of build up. And you're like, oh, that felt great. That was awesome. And then raise your arm up later, and you'll see you have like this shoulder shrug. Because your rotator cuff is inhibited now. It's fatigued out, but you need that. It's a postural muscle. You need that to be able to do your normal activities. That to me is not what I want to do. Build endurance in the big muscle groups, but don't work to failure with the postural muscles.
Okay, but will you still use it as a finisher?
It depends on the muscle group. So it depends on the muscle group and the activity afterwards. But yeah, absolutely. Like a wall sit, I think that's a great example, because I don't think that's postural based. If we're trying to build up some capacity and some endurance, maybe in the quads, then yeah, absolutely, we would do that.
The whole world is in love with hamstring injuries, hamstring rehab, and everybody is in love with Nordic curls. So what's your how much of Nordic curls and how much of RDL and single leg RDL?
Yeah, I totally agree. I mean, if it's funny, if you look even in baseball, right, which, baseball is like the most sedentary pro sport there is, right? You like, you literally stand around or sit around and then go, right? So one of our primary injuries and one of our most common injuries other than throwing arm stuff is hamstring strains. And it's funny, I think there's a lot of factors that go into it. Nordics are one, and that means essentially like your hamstring strength essentially with Nordics, or your ability to produce torque, is only one part of the equation. It's a very important part of the equation, but I think equally as important is sprint capacity. And for us, we're a very good example. Say you're a baseball player and you're in the outfield, right? For us, right? I'm sure it's similar in cricket too. You may not be running around that much, and maybe you haven't gotten a hit in a few days, so you haven't even run the base pass. You just keep striking out. You're in a slump. But then all of a sudden, you have to run as hard as you can in max effort sprint, and you haven't sprinted in 5 days. Your hamstrings are ready for that, right? So to me, it's about building hamstring strength and capacity through Nordics, but also with sprint capacity and max effort sprints, and kind of putting that all together. That's how we've been approaching it. I don't know. Give me 5 years, and I'll tell you if it was successful. But that's our current thought process.
Mike, one very interesting question. How many of the American, sort of league players in basketball or baseball or NFL actually do weightlifting? How much of them do the clean and jerks and stuff?
So I think at this point in time, the majority of them do, right? And we've seen this evolve from the 80s, the 90s, the early 2000s, and now we've seen this evolve. And I think the concept of strength and conditioning in sports is pretty much uniform now. There are some like specialty sports that are still trying to embrace this. So like gymnastics, maybe even swimming to an extent, that are trying to embrace this. But I think in the major sports, everybody knows that if you are bigger, faster, stronger, more powerful, it's going to lead to a better sport performance, right? So I think a lot of people appreciate that and understand that. So I think it's very common right now. Now you mentioned like cleans and jerks and stuff. So for us, we consider that the Olympic lifts in there. Not all of our athletes do Olympic lifts, right? Because maybe we don't want them to snatch or to get into a clean position or something like that. But we'll still do power-based lifts and maybe just not Olympic-based lifts. But I think most of our higher level athletes, and that's trickled down to college and high school and youth now, are involved in strength and conditioning for sure.
When you say power-based, what sort of exercise they do other than Olympic lifting?
So for Olympic lifts, we include things like, the clean, the jerk, the snatch, right? So for power based, to me, that's more like squat, deadlift, bench, right? So a little bit just, different. The difference between the Olympic lifts for us and some of the other lifts is that we're not loading them with speed at end range of motion.
Right.
To me, Olympic lift is a sport. It's a sport. It's not an exercise. It's a sport. So you have to train it. There's a big learning curve to learn it, to master it. To me, it's a sport, right? But like you can do a deadlift, for example, and have benefits in almost every sport.
How much of heavy squats and deadlifts for the tall basketball players?
We'll do a good amount, right? I think for basketball players, I would focus on both, right? I mean, the more that you can deadlift and squat, probably the more powerful you'll be with like your jump performance, for example, right? So we definitely do a good amount of that. But like we said previously, we'll combine that with both bilateral and unilateral training to make sure that we're getting an effect on both. But absolutely, yeah, that's important for all athletes.
Brilliant. I know you love your standing W's when it comes to mid trap. Your go-to exercise for mid trap and low trap?
So for low, I would probably still say it's a prone Y. The shoulder Y. I think the shoulder W's are pretty good too. But I just think that gets the difference between the W and the Y is that we're getting both upward rotation and some protraction with posterior tilt of the scapula. And I think when you put all those three together, it's more kind of functional with the dynamic of the scapula. So I would probably still say I'm probably still leaning towards the prone Y exercise.
Okay. Early morning stiffness for older athletes, especially in, let's say that like a war veteran, 10 years of sports in professional leagues and stuff like that. And he most of the time wakes up with stiff back. And we all, that there's a little bit of facet degeneration. So what is your go-to methodology when it comes to creating a prophylactic program for them.
That's great. That's a good program. One of my general philosophies with athletes, and this is more applicable to the person you just mentioned there, is that every time you compete in your sport, I want you to look like you. Okay. Now, so what does that mean? So let's say you or I, we just went out and we did 10 sprints right now, just out of the blue. We just went outside, you left your house and did 10 sprints. How would your hamstrings feel tomorrow? What do you think?
Bloody sore.
Right? Sore and tight, right? So as we get older, we handle the stress of those activities even worse, right? And so what happens is, for me, I want to get you back to your mobility. I don't want to necessarily overstretch you and get you more mobile. I want you to get back to you. So oftentimes, especially in the older athletes, some sort of like heat is effective to start. So that could be a warm shower, that could be a bath, a hot tub, a moist heat, whatever it may be that you have. And then we'll probably go into some self-myofascial release things. So foam roll, the vibration guns, whatever it may be, or we'll do manual therapy with our hands. And then a nice kind of like a movement prep exercise. So I just had an athlete, his back tends to lock up. He's one of those like hyperextended athletes. And we just went through this. We said, hey, when you wake up, I need you to wake up. I need to do some pelvic tilts, some bridges. I need you to do some windshield wipers with your hips, some cat cows, right? But it's about getting movement in their body, right? So you're stiff because you're starting to kind of relax, and your body's saying, hey, I want to heal. Like, let's not do anything today. I want to heal, right? And you have to say like, well, let's move it up. Let's kind of grease those joints a little bit with some basic movement.
You have two halves. One is a strength and conditioning coach. One is a therapist. Clearly there, the therapist came alive. Is there a confirmation bias towards the therapist coming out in that question?
That's a good point, right? Yeah. And that happens all the time, right? With the person in front of you. That makes sense.
Hands-on or exercise-based? You're a person, I know you love your exercise and your prophylactic program and stuff like that. So you really think hands-on has got still a place in the therapy world?
It's dying for the wrong reasons. I think it's dying for poor discussions on social media and the internet right now. I think it's gigantic. Our big core fundamentals like that we teach is when we're trying to either restore, optimize, or enhance somebody's performance, we want to work on mobility, their ability to control, and then load, right? That's our spectrum of what we do. And we've talked about that in a lot of the things we just talked about right now. To restore mobility, manual therapy is gigantic, right? You can have people immediately have improvements in their range of motion from some neuromodulation or whatever it may be, that it's huge. I think like anything else, it's gotten a bit of a bad rap because maybe it was overused. I'm not sure, but every person I work with and everybody that I know works with gets a portion of manual therapy as part of their program. But I think if you do anything in isolation, either manual therapy or exercise, you're leaving some potential gains on the table, right? You're not maximizing their potential outcome. Right. So I think it's really short-sighted to see some of these arguments on the internet now that manual therapy is dead or we should avoid it. We get tons of great benefits in the ability to help people move better and feel better by doing manual therapy. And then the exercises we're about to do are going to be that much more helpful now that we can do that.
Lovely, Mike. It was great talking to you. I mean, we just want to you to run through your little part of yours in your teens, what sport you played. I mean, what are the type of plays where you grew up, and what are the type of sports you were exposed to? Can you just throw some light on that?
Yeah, I mean, when I was growing up, I think we were back in the generation where we would play everything out in the street or in the field with your friends, right? And a little bit more unorganized, you just did everything, right? So we play, hockey, we'd play tennis, we'd play baseball, we'd play golf, right? We would kind of do like a little bit of everything throughout the day. But as I got older, I started to kind of specialize in. I'm not a very big guy, right? I'm a small guy. So for me, it was baseball and golf. And that's what I kind of did throughout high school. And then at this point in time as an adult, I mean, the only thing I can still do is probably golf. So it's a little limited, but that's kind of a little bit my background. That's why, I've gotten into baseball so much, is just because it was something I grew up doing.
One arms and squats and deadlifts.
For me,
Yeah.
oh man, it's been a while since I've repped out, to be honest with you. I would say, again, I'm a small guy. I would say that I would surprise you with that. I'm strong for my size. If you take my strength divided by my body weight, I bet you it would be pretty good. So
You're a
what's
good
that?
accuracy, so I had to ask you this question.
That's right. That's right. Yeah. So, for me, I focus on quality, not quantity. How's that to avoid your question?
I could see that. That's a
That's
professional
great.
way of evading it.
I like that. That was intentional.
Okay, you need to give me the answer for your all-time starting five NBA.
NBA all time. Wow. Okay. I mean, all time. I'm gonna
MJ,
try to pick
one spot taken. What MJ?
I gotta take. I mean, I gotta get a group of people, right, that I think are gonna play well together, right? So I think we got to start with Jordan, right? He's our number one, right? You don't think Jordan's not your number one? So, yeah. All
Jordan is
right.
my
So we
reason.
got if we go Jordan, right? Then I think we got to go LeBron. So we got Jordan and LeBron, right? What do you think, Dr. J?
Dr. J, Magic.
And then and then Dr. J and Magic. How about that? We'll put that. Magic's our point guard, right? And then I got to get a little credit to Boston. We got to put Larry Bird in there because I need somebody with the outside shot that can just drain them over and over again.
Oh, lovely. Lovely.
You could tell how old I am, right? I picked everybody from the 70s and the 80s.
So, I mean, I'm going to guess it. I'll do a private message on that.
Yeah, perfect. That's awesome.
Great talking to you, Mike. And India is a huge market, and we never know, things will open up here for you.
That'd be great. Yeah, to be honest with you, I have a ton of people that are already on my newsletter and go through my courses from India. It's amazing. I love it. So I've already seen a bunch, and I love that. That's where online's just gotten so cool, is that we can teach all around the world now. So, there's brilliant people in every country, but sometimes it's cool to see what the other countries are doing and see what we can apply. So I love that. So thank you. It was an honor to be on this and to get to chat with you. And I really appreciate it. That was fun too with the rapid fire. So thank you so much for having me.
Had a great time.
Have a good one. Take care.